All right, so let's get into it. Let's talk about HydraFacial Keravive, a product that I have been working on for way too long, but I'm very happy that it's now out in the market. It's been a long time coming. Started working on the product in 2012, as I mentioned before. Specifically with HydraFacial, it's been a pretty long journey as well. We started cooperating on this product back in 2016. So we're now our fifth year of rolling out the Keravive product and the range of products that use these proprietary growth factors that we'll talk about. But just to get us started, let's talk a little bit about the scalp market and the hair market, and especially nowadays in this COVID environment. Things have changed dramatically as far as the type of people that are coming in and presenting with scalp and hair issues. So everybody knows that, hair loss market is a huge market, but a lot of people don't realize that the market isn't 80-20 split between males and females like we tend to think when you think about hair loss. It's a lot more balanced than that. And especially in the last 8 years, especially as I was developing the Keravive, the shift towards women that have been presenting with scalp and hair issues has been quite dramatic over especially the last 6 years. Now, HydraFacial has done some great research here, and you can see here in this particular slide that was a study that was done looking at multiple respondents over 2000, around 2000. We've got 69% of females and 64% of males are having issues with their hair. Now, hair loss is obviously occupies 43%, but hair thinning, brittle or damaged hairs, scalp flakiness, all of these are conditions and situations in which if you take the same approach or a altered approach from what we would do on the face, and you convert that into something that is viable for the scalp, you can really help a lot of people. And you don't have to be out there talking about, hey, I'm going to get 50% more hair, or you're going to see more hairs. It's all about treating the scalp health and having that scalp health improve the hair health just as much as we would improve our skin quality, that would improve the amount of collagen that we have. That's what we're really looking at with Keravive. Some other demographic information that you can see here. Obviously, this is the split that I talked about before. It's not 80-20 like a lot of people think. I think if you ask the average person on the street, who are the people that have problems with hair loss, I bet you everybody would say males, right? I bet you they would say probably like 80% males, maybe 20% females. The reality is a lot closer to 50-50, and it's getting even more so in that respect because of all of the newer types of products and ways that treatments that are done on hair that are actually affecting people's scalps, especially women's scalp health. So this is a perfect time to have something that is not hormone based, that is really just about treating the scalp, treating the health in the scalp, and something that can apply to anybody. That's the key. One of the key things that I would like to leave you with. When I was developing the combination of growth factors, the goal was not to end hair loss, right? That was not the goal. The goal was to provide a product that changes the structure and improves the structure of the scalp to produce healthier, fuller, stronger hair, regardless of who it is that you're treating. So you have something that's available for people who want to do it when they're 20, 25, 30 years of age, to people who are maybe going through late in life loss around in the 60 years of age. It really shouldn't matter. Hair and scalp health is for everyone. And so if we quickly just look about the causes of hair loss, I could spend 30 minutes just talking about hair loss conditions and issues. I won't, because it's not entirely relevant to what we're trying to do with Keravive. The key about this is to know there's a bunch of different things that causes hair to fall out, right? And we're not absolutely concerned with all of the various different conditions and things that can cause the hair to fall out. What we're really interested in is how do we get that hair to grow to be its best hair, if you like, right? How do you make sure that the like the grass that's growing in your backyard, how do you make sure that the soil is fertilized and perfect, in a perfect condition, so that when your hair is growing, it's growing the best it possibly can be? And again, talking about the switch between the genders, there's a lot more hormone-based issues when you talk about males with hair loss, with their DHT and things like that. Where with females, it's kind of spreads more to stress-induced, or even traction-induced or product-induced damage to the scalp, which therefore damages the hair. So again, as Keravive, we're not going after this DHT or trying to get and interrupt the areas that are causing the hair to fall out. We're really concerned about being the stimulator and the fertilizer. And I use this analogy all the time, is what I will say is, hair loss is like the weeds in your backyard, right? And so if you've got some weeds in your backyard, you have a brown patch of grass around it, it's not growing, it's being suffocated. That's the DHT hormones or any of the oil treatments and traction treatments. They're the weeds, right? And those weeds need to be addressed. And so you need to address those weeds. Keravive is not about addressing the weeds. But once those weeds are addressed, once they're plucked out of the grass and they're removed, and there's no impedance there for that hair or slash grass to grow, what do we want to do? We want to speed that process up. We want to make the soil even more fertile. How do we do that? We put in fertilizer, and Keravive is the fertilizer for everyone. So if we look at the current options, there's a bunch of what I call the lotions and potions. And I don't mean that in a derogatory way. I mean that there's just a lot of stuff out there. There's a lot of things that are based on systemic. So you take a pill and it increases your biotin levels, iron levels, and things like that have been shown to influence how much keratin you have in your hair and how healthy your hair grows. But there's also the minoxidils and all of these other types of treatments that are trying to also treat DHT, or they're also trying to reduce inflammation. They're trying to do some other type of a way to reduce that cause of that hair loss to fall out. When I started in 2012, I was really disappointed to find that there wasn't a fertilizer. I expected like there was going to be a ton of different products, and I see all the different products, and I went through all of these different ones, and the closest thing to a fertilizer or a pro hair type of product was the laser caps, which were the red laser caps, red light, that increased circulation. And so when you looked at it across the board, the only things that were even close to being fertilizers were all about circulation, right? All about increasing microcirculation in the scalp. So that was a key point to look at, but then expand on. And this becomes very, very interesting when you start looking at what some of the new modalities are. And then when you actually look at what the HydraFacial just by itself is as a increased vascularization type of platform. But let's call these the second wave of treatments that exist now, which of course transplant is if you don't have any hair at all, you've got to put some hair in there. That's transplant. But this idea of conditioned cell media, the PRPs, injections, microneedling, mesotherapy, that you have quite a significant presence in Europe that we don't have here in the US, of all these different types of injections. Again, this is kind of like a second kind of wave of treatments. Now, again, some of them are targeting really having effect on the circulation. And the key after this is I felt when I started looking at these technologies and stem cell media, it was kind of like a giving up type of approach. It's like, let's just throw everything that we have. We don't know what works and what doesn't work. We'll just use everything. And that helps a lot of people. So I don't discount that. That's a completely legitimate way to be a fertilizer. Just take a bunch of stuff that we think works on the skin, on the face, and we'll just throw that into the scalp and see if it helps. And it does in certain circumstances. But for me, coming from a laser background and coming from all about specificity, my goal was, hang on a second, there must be growth factors, there must be proteins, there must be ones that are more important than others. Let's try and find out what those are. And if we find out what those are, let's now make a formula that's kind of bespoke to a formula that would be pro scalp and pro hair. And that's what brings us to the HydraFacial Keravive. Now, The Keravive is made up of serums or treatment solution and a spray. So there's a microdose, and then there's the treatment serum itself in the vials. Now, regardless of how Keravive comes, whether it comes in a take-home spray or whether it comes in the treatment serums or the treatment solution vials, the growth factors are the same. And this is the area that I'm going to spend a bit more time on, which is how we selected what these hyper concentrated growth factors are, why we chose certain ones, and how we actually manufacture them in a way that is not from human origin, which is also very important. So the Keravive contains what I internally called like the Keravive peptide complex. And that's just a fancy way of saying James came up with a bunch of different growth factors. I started with 10, if you can believe, at the beginning back in 2012, and found out over that period of time, only 7 of those could be synthesized biosynthetically. And in addition, only 7 of the 10 that I really wanted were actually had any considerable amount of bioavailability. So bioavailability is key, right? Because if it doesn't matter what you use, if you are not having something that's going to be absorbed in the right spot in the scalp, you're not going to have something that is going to be effective. So that very much influences the selection of the different, the 5 growth factors that we have and the 2 proteins. It also affects the concentration. And this is where Keravive starts to separate itself from some of the other approaches like PRP or even conditioned stem cell media or cord blood derived media, because we are selecting only singular types of growth factors, growing them independently in a lab to a specific concentration, and then we are wrapping them in what we call a nanoliposome. So the key here is that there's 7 different ones. Each one is made independently from the other, and each one is independently wrapped in its own carrier. So if you look on the right-hand side, you're going to see there's a fluorescent test here where we actually attach a fluorescein to one of the growth factors and see how it penetrates the scalp, how it can get into the scalp. And so what you can see here is obviously the left is the non-treated, the right is when you have a growth factor, a biosynthetic, a biomimetic growth factor without nanoencapsulation. You can see that there's a very small amount of green right at the entrance to where the hair duct is, right there. A very small amount compared to the side where these are now, it's one growth factor and it's one growth factor only, and it's living in its own liposome, and it's able to get a much better penetration into that hair duct, which just happens to be, for our purposes, for hair and scalp health, the best place to be. This is really the only place without making an injection or without making some type of microneedle injury. This is the only place where you can get these growth factors to be absorbed. So without the nanoliposome encapsulation, you wouldn't have an effective product that you can use at home or an effective product that you could use with the HydraFacial system. Because obviously we are not using needles, we are not using any type of injection. This is a completely no downtime, non-invasive procedure. Oops, skip one more slide. So this is really important because I think that a lot of people don't quite get, where growth factors are absorbed, where the highest bioavailability is, and why you can actually deliver them into the scalp using the correct formula. Now, what you can see on the right, and what a lot of people forget, is that the epidermis, that basal epidermal layer, grows around every single hair follicle. If it didn't, then your hair follicles would be an ingress point for bacteria and infection, right? So even though your hairs can go as deep as into the subcutaneous fat layer, they're still encased in the epidermis. And this is where transepidermal delivery is the most efficient way of delivering growth factors that you want to specifically get into the scalp and specifically start to affect the hair itself. And again, you can see with the nanoliposomes, it really puts us in the right spot. Now, a lot of people will be like, oh, you're using growth factors. Oh, you better inject it. Injecting growth factors over here unless I'm injecting into each follicle one by one, which would take hours, if I just inject growth factors just into the dermis, they have to migrate their way all the way over to where the hair is to be effective. Whereas if you use a transepidermal delivery system like the nanoliposome, it naturally is attracted to those hair ducts, as you can see in this fluorescent staining. Now let's talk about the composition. So we talked about the delivery system and that we isolate each growth factor independently and we wrap them. But one of the things that really differentiates Keravive from literally any other skincare on the market, not just hair care product on the market, is that each one of the growth factors are independent. There's 7 different ones of them, and they're all encased in their liposomes, and each one was only selected because of a particular effect that it may have on the scalp. So if we look at, this is not to say that there's anything wrong with PRP or conditioned media, because they have been shown to be effective. But if you were trying to explain to somebody what the difference is between the two, you could imagine that if you draw blood and spin it up, or if you get conditioned media, you have a bunch of growth factors. You have a bunch of growth factors that can be positive for collagen. It can be positive for just circulation. It can be positive for cell differentiation. You've got a lot in there, and you don't quite know what you have. You just know that if you throw it at the skin or if you put it into the scalp, something happens. And that's quite fine. There's nothing wrong with that approach. The Keravive approach is much more specific in the fact that you can see on the right here, we've got 7 little guys, like these little tendril little balls here. These are the nanoliposomes, and encased inside each one of those is a specifically concentrated amount of one of those growth factors. So you don't end up with all 7 fighting for their own way into the scalp. Each one is wrapped independently, and they are selected based on their 1, bioavailability in the scalp, and 2, on their ability to affect the scalp health and the hair health itself. So that's a bit about the composition of the Keravive. Let's talk a little bit about the treatment. So obviously, like anything that HydraFacial does, this is an add-on treatment. It's an add-on technology, but it's also something that is no downtime, not painful, and it's a unique, relaxing treatment. So just as much as we want to replicate that lovely experience that people have with HydraFacial on the face, we want to replicate that same experience on the scalp. It's very simple. It's like doing the skincare, but for the hair, where we're taking the same approach that HydraFacial is known for, with the immediate increase in circulation, the immediate ability to exfoliate, and then nourish, hydrate, and protect your skin, and in this case, your scalp. So there's a couple of stages that we do, just like you would with your regular HydraFacial treatments. So of course, the vacuum technology, the vortex technology, allows us to remove all of the dead skin and any types of oils and remnants that are left on the scalp. And that process by itself will help the health of the scalp. Just by removing all of that gunk that sits on the top layer of your scalp, from people maybe who don't wash their hair as much, or they don't have a good shampoo that they use at home, and a whole bunch of other reasons. Just like we have those reasons for the face, we wanted to get all that stuff off, and just that by itself will make a difference. In addition, as you know, you're going to see the scalp's going to get pink. Well, when you see pinkness, what does that mean? Well, pinkness is blood. That's blood coming to the surface. So that's increasing the circulation. So even before we've delivered any growth factors to the scalp, we've already done 2 things that make a huge difference for the scalp and the hair. Then it's all about those custom growth factors and their custom concentrations with their nanoliposomes being fused into the scalp to then be that fertilizer that we want to restructure the health of the scalp that will help with the hair in due time. So the booster, the Keravive booster, that has, again, it's basically all growth factor. So there's very little of anything else in this booster except for those nano liposome encased 7 different polypeptides. Now, I should mention, we do call them polypeptides because they are a cosmeceutical formulation. They are not to be injected. They are not to be, they are used purely in a cosmetic topical solution, and they are under the classification of polypeptides. So the true way of talking about Keravive is to talk about the Keravive peptides, which if you read the ingredients on the back, there will be 7 different polypeptides. And these polypeptides, as I mentioned before, are human identical, or what we call biomimetic. So they're absolutely, the body recognizes them as if they were their own, but they are available to be topically delivered through the nanoliposomes to the scalp. And the Keravive booster is literally all growth factors. There's nothing else in there. There's no extra extra wasteful ingredients. It's literally all growth factor. Now, the second product, which comes in the kit, is the product called the Keravive Peptide Complex Spray, which is your microdoser. This is what I tell everybody. This is what we can give to the patient, and they can go home. And as long as they use it every day, it's got the same amount of growth factors in it as those 2 boosters. So if you use those 2 boosters, and then the patient, like in a treatment, and then they went home for 3 to 4 weeks, and they used the whole bottle of their spray, they would have doubled up on the amount of growth factors. So if you can imagine the growth factors that are put into the boosters, the same quantity is in the take-home spray, except instead of doing it in a treatment, you're doing it every day. You're micro-dosing, couple sprays a day for the 30 to 40 days between your treatments, and you're going to accumulate the same amount of growth factors into the scalp as if you'd just done a treatment. So that's the way that we double up to get as much growth factors and as much improvement to the scalp and hair health as possible. So some are done at the treatment, and then the take-home spray completes the course. So the treatment regimen for this is very simple, because if we've got a spray that lasts about 30 to 40 days, and it has the same quantity of growth factors in it as the treatment, you would do 1 treatment, take the spray, finish the spray, come back, do another treatment, and repeat. And you do that 3 times. So what that means from the Keravive growth factor perspective, you're getting 6 times worth of dose in that 3-month period of time, because you're doing a treatment, you're using 2 of the boosters, then you want to make sure that your patient's using all of that spray, even make them bring back the bottle empty before their next treatment to make sure that they're doing it at home, because the at-home delivery, the at-home microdosing can make a huge impact on how good the results are. And that's one of the things, is results are okay if they just came and have treatments, but they're nowhere near as good as if they're doing their microdosing at home. And that's why we included it in the treatment kit. So you've got your 2 boosters and the spray. So every time the patient comes back, they get the same kit where we use the 2 boosters, and they get another spray to use for the gap in between. Now, just again, you can see 2016, we did I reached out to HydraFacial back then and said, look, I don't like this idea of needling. I think there's a much more elegant solution. And HydraFacial, you have the most elegant solution to 1, remove debris, 2, increase circulation, and 3, fuse products into the skin. There isn't anything like HydraFacial to be able to do that in a non-invasive way. So back in 2016, I approached HydraFacial and said, hey, I've got this crazy serum that I've been working on. I'd love to put it in the HydraFacial and see if we can make it work. And so this was done with my co-founder, Dr. Amy Taub in Chicago. We did this clinical trial where we looked at a variety of women and men looking at their scalp and their hair health. So here's some patients, again, typical female type of loss, vertex loss, and some improvement. And what you're going to also notice when you look at these photos is look at the color of the scalp, right? Because the color of the scalp, you start to see the quality of the scalp changes. This is a home run, right? This is one of our home runs from, and this is one of the Actually, he's a husband of one of the people that works in Dr. Taub's office, and his wife was very diligent with him using the Keravive spray every day. She would make sure, check with him like a little kid, check with him that he did his spray every morning. And he had one of the best results. So it's very much shows that if you do your boosters and do your sprays, you can get quite a substantial change. This is the back part of his scalp. Again, look at the color of the scalp. The color has changed. It's almost darker. Darker means that there's more circulation there. And that's what we expect from not only the growth factors, but the HydraFacial treatment just by itself. Then in addition to the little small proof of concept that we did back in 2016, HydraFacial did a very large multi-center study where they looked at a variety of different markers as far as patients' improvement. And so out of all of the people in this study, 70% reported an overall improvement in their hair at the third visit. Now think about that for a second, the third visit. That's only 3 months in, and hair takes a long time to turn over. So if we were able to show that people could appreciate a change to the quality of their scalp and a quality of their hair at only 3 months in, imagine what their hair is going to be like 6 months, 12 months, 18 months down the line. As long as they can maintain their scalp improvement, scalp circulation, and they don't go backwards, they're going to have quite a significant change. Now, of course, the last point here was 75% of the participants saw a change in the fullness. And again, this is at visit 3. So this is only 3 months into the treatment. They've really only had 2 treatments at that point in time. They had 1 month treatment at 2 months, and they came in for their 3rd treatment. And that's when they were asked about if they noticed a change. That's also the reason why we space the treatments at a month apart with the microdosing versus trying to do them at like every week or every 2 weeks. I get a lot of people that ask me questions, hey, can I do this every week? And my response is, of course you could. But if you do 3 treatments and you do them at a weekly interval and you're only 3 weeks in and the patient thinks that they're going to see some type of result, they're not going to see anything at 3 weeks. So the key is the spacing between the treatments is to try and coordinate something that is not too far out. So not like 2 months or 3 months between treatments, but something that is a balance between not too soon, not too late, to a point of which around the 2nd or 3rd time they're coming in, they're starting to appreciate that healthy change in their scalp and their hair. So that's it from me about the technology behind Keravive and some of the original research work that we've done. And now I would like to pass it over to Dr. Sharina to talk about her own clinical experience, which I'm fascinated to see how she's been getting on being the first Keravive customer or account in Europe. So, Dr. Sharina, over to you.
Thank you very much, Dr. James Bartholomeusz. That was an absolutely fascinating presentation. I thought I knew everything I needed to know about Keravive, but I made a whole bunch of notes, Dr. James. So thank you so much for giving such an insightful presentation. I'm just going to share my screen with everybody, so please do bear with me. Okay, here we go. Can everybody see that? Please give me a thumbs up. Thank you so much. Okay, so good evening, everyone. And thank you so much for joining us today at our Expert Hour. I would also like to congratulate Dr. James Bartholomeusz for his 8 years in creating this fantastic formulation that has finally played a part in my patients' lives and myself. Good evening, everybody. My name is Dr. Sharina Balaratnam. I am a former surgeon in the NHS, where I spent most of my time in reconstructive plastic surgery and burns. So I've always had a very, very strong passion in skin, from restoration, the structure and function. And very similar to James, I found a huge amount of interest in the evolution of energy-based devices and the science in aesthetic medicine And lo and behold, I have transitioned wholeheartedly into this world. I have traded my scalpel to everything tech-based. And with a passion in skin health, this has led me to really understand how injectables and the technology behind skincare, as well as my energy devices, can be used and integrated in my practice to generate better skin health and for better quality of lives for my patients. I'm the founder and medical director of my own practice here in Buckinghamshire, and I would say that my specialism is in treatment blending to see how all this technology improves the quality of health. Today is to share with you my 1-year experience of the HydraFacial Keravive treatment at the practice. We're delighted to be the UK study center for HydraFacial Keravive, and we've had the treatment for exactly a year. I'm sure you would appreciate it has been a start and stop process with COVID being a part of this, but I have to say, despite the challenge, we have a 100% patient satisfaction. I think I want to stress the importance of exactly what Dr. James has said, and this is a very, very unique opportunity for all of us to take our practices and to think outside the box and beyond the face. We really need to think of a whole body, whole family, and total approach with our patients. And now I'm really excited that post-lockdown we get to reopen and deliver better quality results to our patients with Scalp Health literally thrown in right into the heart of my journey. So where did my HydraFacial journey first begin? I want to take you back to 2007, actually, when I had my first HydraFacial HydraFacial treatment myself. And I remember thinking to myself, I looked good after the treatment, but I felt fantastic. And I knew that even back then, I was going to have HydraFacial in my clinical practice one day. Fast forward that 10 years, I now have 3 devices. We started with 0 patients, and how we really grew HydraFacial at the practice is because it works. For those of you out there who've not had one, please have one, because myself as an ambassador, my team are ambassadors, and our patients all believe in the device and the results that they get every day. Our second device followed suit 9 months later, and we have 3 now. And what I can say about the treatment is it integrates into every little step of our patient journey, whether it's from topical skincare, integration into pre-lasers, post-lasers. It delivers a better quality of skin health, even with my facial injectables. So it sits alongside everything that I do at the practice. It was around the 2019 mark. And again, like Dr. James, it comes from a personal experience. I was noticing, like with everybody, changes to my hair. And those changes doesn't need to mean female pattern balding or an extreme loss, but there were definitely changes. And I thought to myself, what could I do to myself that's going to give me a better quality of scalp health? So I was looking for something that was going to integrate easily into my practice, as I wasn't quite there to introduce something like a transplantation procedure. I also want to specialize in something non-invasive. So lo and behold, when HydraFacial announced that they were introducing a scalp treatment, for me, it was an absolute no-brainer. And when I listened to the science, for me, it's got to be results driven. It's got to be data driven, and it's got to be evidence based. And as you could hear from Dr. James's presentation, it's about what is in the formulations and how they work. And I'm sure you'll agree, it all completely makes sense. So for me to bring something into the practice like this in March last year was very easy. And I'm very, very excited that we're going to relaunch it when we reopen again. Why do we do what we do? We do what we do to restore patients' confidence and aesthetic well-being. That's literally what we're doing every single day. This is a skin patient of mine. She is a HydraFacial patient on topical formulations. And you can see in a 12-month period, she just looks better. She looks healthier. There's less inflammation. And she just looks like a much happier person in herself. And she's aging better. So as Dr. James said, we do need to do something to our patients and with our patients to improve their well-being. But you can see in 1 year, everything has improved. But the one thing that hasn't changed is her scalp health. If anything, I'm sure you'll agree with me, she's thinning. So I urge all of you to think outside the box and be open with your patients and mention to them what we're actually seeing. So this is the reason, again, why I decided to bring Keravive into my practice, because we need to think beyond the skin of the face. We need to treat the patient and not just what they're presenting with. And now's not the time to go quiet. I think we're confident in our own right to have these conversations. 2021 is the year where health is wealth, and everybody's really excited about looking after their immunity, their diet, their nutrition, their cleanliness in themselves as well, detoxification. And more than ever now, people want to approach their quality of lives even better. With the strong HydraFacial reputation that I have in my practice, and also from the brand itself on a global basis, it's easy enough for me to have these conversations with my patients, and I'm excited to be able to introduce something new to them for when they come back. Patients deserve that. But when I look at patient trends or consumer trends, the one thing I do notice now is increasing stress levels. We look at our male patients, only 10% of my patients are men, but those who do come to see us have mentioned issues like considering transplant surgery. So I want to be able to give them something that's going to, as Dr. James said, fertilize the soil, make it and prepare it so that when they do have their procedures, it's just going to improve their chances of success. And all I want to do is improve the success of a quality of life for my patients. For those of you out there in the Middle East, we do have cultural trends to also address and to respect. It's extremely hot in certain parts of the world. Headscarves and excessive sweating underneath them can also cause irritation to the skin of the scalp. And there are different trends, hair products, hair care that we need to also respect. So with me, it's about being able to articulate that with our patients. And for those of you who've been in my practice, you know I'm all about the tech, and I use tech on a daily basis to communicate with our patients. I always believe if my patients can understand their aging process and they can appreciate what's going on, then they will be able to identify, understand the treatment, and follow through with that as well, and to celebrate the success. So we brought on board this time last year the CanFeel Hair Metrics technology. So very similar to our CanFeel Visio skin analysis, this now is the world's first AI-driven, non-invasive hair consultation service that can provide immediate results and immediate measurement of the scalp health of unclipped hair. So it's totally non-invasive, the results are immediate, and I can then have that fantastic consultation with the patient and show them what is your health right now. And then we can also create treatment plans with the HydraFacial Keravive, and we can track their results, as Dr. James was saying, month on month on month, and celebrate and learn and understand the trends in better performance scalp health. So we can educate, engage, and also connect with our patients better before. Let me take you through some of our before and afters. So I have had possibly 2 to 3 months worth of real full-time experience, because as soon as we brought in HydraFacial Keravive, we pretty much went into a lockdown here in the UK for 3.5 months. So when we came forth in July, this is where it all began. So this is actually my best friend who'd been harassing me for 5 years to bring a scalp treatment to the clinic. And you can see just after the one treatment, she's got a thicker hair, she's got a fuller hair. And she herself says that feels like there is more of it as well. Look at the crown of her scalp. You can see that where you can see more scalp on the picture of the left, just one treatment later, 2 months later, you can see thicker, fuller. And as Dr. James was saying, the color looks better. It looks more rich. It looks more healthy. And now that Dr. James has mentioned, I'm looking through at the scalp skin, and it looks to be much more better perfused. There's a better color to it. So I'm sure you'll agree, and these are only very early studies. I'm really looking forward to seeing her month 3 and month 6 results. These are our CanFeel Hair Metrics System results. And I want you all, ladies and gentlemen, to focus just on 3 things, because I appreciate there are a lot of figures there. I want you to focus on the third count, which is follicular count. And I want you to also focus on average hairs per follicular unit. And finally, I just want you to look at the third thing, which is just the color of the skin of the scalp. Let's start with the color. I'm sure you can appreciate the picture on the left, which is day 0 pre-treatment, compared to the right. It just looks better. After one treatment of removing all of the dead skin using the HydraFacial in-clinic treatment, you can see there is less dandruff, dead skin on the right compared to the left. You can also see a much more healthy, less inflamed color skin on the right as well. And basically what's happening with the figures is, if you look at the follicle count on the left, which is 69, you now have an increase in follicle count of 78 on the right. What is this telling us? It's telling us that using the HydraFacial in-clinic treatment, we're able to deep cleanse and exfoliate the actual skin of the scalp, and that's enabling the follicles to stimulate again. We can't grow new ones. We're born with X amount in our lives, but we can certainly wake them up, those which are dormant. Look at the average numbers of hairs per follicular unit. On the left, 1.3, on the right, 1.6. What does this mean? It means that we're able to open up these hair follicles again, which have been contaminated with products, and we're able to let those hairs out. So these are all very successful results just after one treatment in 2 months. Patient number 2, again, these patients are in their mid-40s. When it comes to the follicle count, you can look just after one treatment, and this is month 2, the follicle count's gone from 73 to 113. What does this mean? We're able to deep cleanse and exfoliate, and with the proprietary products that Dr. James has created to push through the scalp and to fertilize the soil, we're able to see now average follicular hairs come through from 1 to 1.1. And this is really powerful because it means that in a short space of time, we're seeing increasingly positive and very dynamic results with just a one treatment and 2 months later. Same patient again, you can see on the picture of the right, this is the occiput, the back of the head. And I'm sure you can appreciate now her scalp health looks cleaner. The follicle count's gone from 76 to 106. And so these are very strong, powerful results that we're seeing for the very first time with an average hair follicle unit going up from 1.1 to 1.4. So we're seeing these consistent trends at the moment, and I'm looking forward to what's to come. Patient number 3, beautiful girl, age 40s. And look at the transition across day 0, month 1, and month 2. I'm sure you can appreciate that her hair just looks thicker, shinier, more glossy, and she looks better. It doesn't look as dry and as brittle. This is her from the rear, and I'm sure you can see exactly the same thing happening again. She enjoys doing the treatment because she feels that she's giving something back into herself. What was really interesting when we went from day 0 to month 1 with her was when I looked at the picture of the right, I couldn't quite understand why in her case, her follicle count actually went down. Now, I think this is the one thing we need to appreciate as doctors, as healthcare physicians. Our patients are real time. They go through stresses, challenges of the life. And when I asked her, it's anything changed in her life, because I would have expected her results to get better. She then said that she had undergone a surgical intervention. She had general anesthetic, and she was extremely stressed, lots going on at home. So I think we can appreciate that stress plays a very important negative influence on the skin of the scalp and the overall health, and also with medications as well, especially prescriptive medications. But lo and behold, when she had a second treatment and we then remeasured the scalp, I'm sure you can appreciate things look better. The scalp has been deep cleansed, exfoliated. She's now had 2 months of Dr. James' proprietary product, and the follicle count has now increased from 88 to 124. Same again, you can see a cleaner, healthier, better looking scalp in the same patient. What are we understanding from this? Essentially what we're doing when we're seeing inflammation on the skin of the face, don't forget, it's the same thing. So we're getting inflammation on the skin of the scalp. So these are conversations that we should have with our patients. Same again, patient number 4, slightly older patient in her 60s. And this is a patient who was considering having transplant surgery, but we can show her with just one treatment, 2 months later, she's almost doubled her follicular count. So it's been unplugged, it's been unleashed, and it's been stimulated with the microexfoliation and the lymphatic drainage and absolutely everything. And the average hair per follicle unit has gone up. So we can see this consistently. Patient number 5, who is a TV news presenter, the global effect on the skin of the scalp and the follicular count almost increasing by 1.5 times. So we're seeing this consistently from patient to patient, and we've just received a 100% patient satisfaction on not just the result and not just the treatment, but the overall experience of feeling lighter and happier and just feeling better about themselves and wanting to take control. I know from my team's feedback, they love doing the treatment. It's easy to perform. And now I can make my HydraFacial devices work so much more for me and for our patients as well. My top tip will always be to talk to our patients, because now more than ever, they want to go barefaced. They want to go bare hair. They want to, refer their daughters and their sons and their husbands, really. So we're seeing a lot more patients at home, and they want better quality health more than ever now. I call this a Zoom hair trend, and I want to be a part of it to make sure that they get a better quality hair. So what is next for me? I want to spread this love with absolutely everybody. I've been a patient and I love my treatment and results. And I'm delighted that we were able to feature the treatment in the Tatler Beauty and Cosmetic Surgery Guide only just last week. So it is out there, ladies and gentlemen, and we now have a treatment and we have a product that is here for absolutely everybody. It is not a gimmick. It is not anything that doesn't work. We have the science now using metrics and using AI to prove that it does work. So this is a short synopsis. I will be delighted to take questions, but I'd like to say a big thank you to Martin and Banu and Paul Simmons at the HydraFacial UK. Big thank you, Carolina Borrego, Kate Gilbert, and all the team from HydraFacial Global, Amda, you too. And a massive thank you to all of my team at S-Thetics, and a special shout out to Lydia for helping me pull these slides today. Thank you, everybody, and have a great evening ahead. James, over to you.
Thank you so much. That was fantastic. It was I've never been able to see something so so beautifully analytically done and presented. Thank you so much for sharing that. And as you said, it was in the very beginning. I can't wait to see these at 6 months and 9 months down when we've got a few, many more months of some of that new healthier hair coming through. So I think Beth, I think we have a bunch of questions.
We do.
Yeah, so I'll hand it to you, and maybe you can choose who needs to answer which question.
Sounds great. And can everyone hear me okay? James, can you? Yes, so then I'm going to assume that's everyone. Dr. Sharina, absolutely incredible, powerful presentation that makes me so excited. I love your hair metrics, a study or little anecdotal study that I just love it. And, I love what you were saying about expectations, right? And on your one patient, they didn't have that, the follicle count might have gone down. And that's a part of educating your patients, right? Because of that, the cycle, the growth cycle. It's just every follicle's in a different stage at a different time. So, where some people might get immediately kind of disappointed and say, well, wait a minute, the follicle count went down. You just explained it so beautifully, and you're so passionate about it as well. And what a delight and a pleasure to hear your presentation. And I absolutely loved it. We have a couple people that have chatted questions in the chat box, and I'm just looking time-wise, we have about 7 minutes-ish left. But for the questions in the chat box, when James and I first did the Expert Hour US, we got some of the same questions. So in respect for time, the questions that are duplicated in the chat box, with this recording that we have, we'll go ahead and share the chat box questions as well when we share the recording on whatever platform Anda puts it on. So for that, just as or in respect for time on the chat box. But there was one question that we get asked, and I wanted to toss this to James, is that so the treatment is 3 months, 1 in office, take home spray once or twice a day for that. I love how James calls it microdosing, which is such a great terminology to extend and enhance, right? So it's just this beautiful 1-2 punch. You're doing the in-office treatment with the biomimetic peptides that are super concentrated, and then the microdosing, which I love, that you use in your take-home spray. So our protocol, we suggest for a 3-month protocol. So what can you expect after that 3 months? Can you do it for 6 months? Would you do it for 12 months? What is kind of the after kind of look like after that regime of a 3-month protocol, in your opinion?
Yeah, it's a really good question, and it's a very hard one to have a specific answer for, a specific patient. What we try to do is find a balance. Everything is about a balance. We don't want to have a treatment course that's prohibitively expensive and very, very long, before patients start to appreciate the change. And so everything is always about a balance. And so we settled on because of the cycle, because of the time that it takes those anagen hairs to grow out of the healthier scalp now, because it's not like the hairs are falling out and we're getting new ones coming through. They're just continually growing through better, right? They're coming through thicker. You need to have at least that 12-week period of time. So in order to at least see some form of a change, like a 20 to 30% improvement or something like that, we're seeing more than that. I like to under promise and over deliver, but But to get even a small amount of change, it's got to be that 3 months. Now, as you said, the next question we get is, well, can I just keep on doing it like indefinitely? And it's like, well, if money is no object, of course you could do that. But if you wanted to be a little smarter about it, what you would do is you would do a course. You would wait at least another 3 months. So then you have a good 6 months worth of change. So half year's worth of change. And then you could repeat the course. And so if you really enjoyed and saw the improvement over that 3 to 6 month period of time, come back in and do another 3 treatments over the next 3 months. And then we're generally looking at, if you're using the spray at home, and you can buy the spray separately, you don't have to come in for a treatment to get the spray. I know that was a question that people had. If you're doing your microdosing at home, you can hold your result indefinitely. But a yearly top up wouldn't be a bad suggestion, which is a course once a year would be advisable. So no, so it's a very important thing to look at. I think that the key thing, and this is why I love the hair metrics approach, is that you've got to do the diagnosis, right? Like, this isn't a miracle product. This isn't Miracle Grow for your lawn. I designed it to be Miracle Grow, but it's not Miracle Grow, right? So, you are still having to deal with a living, breathing human being that has a variety of different habits and traits and lifestyle, right? And so I think the critical thing before you kind of just throw somebody into a Keravive program is to get a baseline of where they're at. So why did they get to this position? Why is the hair thinning? How do they wear their hair? Is it because they don't wash it? Take a photo of the scalp, get it, have the hair metrics, do the analysis, right? And then get your baseline. And then once you get the baseline and understand the things that may be influencing that cause of that poor hair health, we can correct those separately, and then we can boost with Keravive. That would be my approach. And I'd love to hear, Dr. Sharina, your opinion on that.
I completely agree, Dr. James. And this is why we always go back to the consultation. I called it underpriced attention, really. And we would never just take a booking and put somebody on the couch and just do the treatment. That just goes, well, it's just not in our DNA. So the consultation is really important, because myself, I would generally never ask another woman, do you wear hair extensions? It just wouldn't come into my vocabulary. However, I think it's important to be able to, now I actually just ask, part of the consultation, are you experiencing changes in your body? Are you experiencing changes in your scalp? What about changes in hair? And it's fascinating to actually now have patients actually say to me, actually, I've been having hair extensions for the last, 15 years, and nothing's changed. If anything, my hair's getting thinner and more brittle, and I'm now in my 40s and 50s. So we learn so much more when we go back to that history taking. So I urge all of you, if you find it embarrassed to ask the question, create an area of interest questionnaire. So that way the patient can then circle what's actually wrong with them and highlight some of those questions, whether I've got dry, thin, brittle, dandruff, female pattern balding, anything. So when it comes to then the history and the consultation and the assessment, the hair metrics, as Dr. James, you've said, it allows us to really have that real-time dialogue with that patient. And patients then mentioned then to me about traction alopecia, which is really coming about from not just putting the extensions in, but actually taking the extensions out again. And I had no idea. I don't embark in any of those, but both processes have a very negative impact on the scalp health. So what you think you might be doing for beautification in your 20s and your 25s and your 30 and 35 can potentially have a very negative long-term influence on your skin of your scalp later on. So I think this is a great opportunity to be able to educate our patients and educate our consumers real time on what some of these aspects of hair beautification could potentially do for them long term. So you mentioned the word prejuvenation, James, didn't you? And don't wait till it's too late. Aging
Right.
is inevitable, like death and taxes. You know, that is the one thing we're all going to decline in. Hyaluronic acid, collagen, elastin, hair follicle count numbers. So, you know, why not put something in now? And I do see more of the younger generation starting now than waiting too late.
It's funny you say that. My code name, and Beth knows this, my code name for this product when I started working on it in 2012 was Hair Tox. Because it was like the line was hair tox the loss, right? Stop the loss, right? So the that whole idea again of getting to it before, like you would want to get to wrinkles before you get the wrinkles, right? You want to, you know, reduce the muscle movement to reduce the chances of having those dynamic lines in the future. If we've got something that can pre-rejuvenate the scalp in the same way that we would take that approach on the face, again, that was it's really nice that you say that, because that really was literally the initial kind of genesis of the idea of Keravive.
I just want to add one more thing as well, actually, James, because I see a lady over there has asked about greasy scalp. And, you know, this is where the in-clinic service does a brilliant job. We know how HydraFacial manages the skin of the face. And so to deep cleanse and exfoliate and allow the follicles an opportunity to be well perfused is an absolute no-brainer. It is so, so key. And during the lockdown, a lot of patients just went home with the at-home solution, and we kept posting it out to them so that they didn't run out. I'm going to put myself as one of those patients because I've been blown away at my lateral hair growth over the last 9 months during the lockdown. So it's actually been a fantastic lockdown adventure for me to have in person.
We're going to pass it back to Anda.
Thank you so much.
Thank you both so much. Thank you.
Yeah, thank you. Wonderful presentations and wonderful dialogue. But unfortunately, we are already running over time. I would like to ask one question to both panel members, to both clinicians. So, if you would have to give one advice to a new starter who would like to start Keravive in their practice, what would be that one key ingredient that he advised me? Just one advice. So, Miss Sherina.
Ooh, okay. I mean, all the ingredients, you need all the ingredients. They're all necessary and they're all relevant. Otherwise, they wouldn't have been put in there by Dr. James in the first place. So they all have a purpose. If I had to say one thing to all of you out there considering it, have it yourself. You need to know what it feels like. You need to experience it for yourself. I don't think you'll be able to articulate it to any of your patients without actually trying it firsthand. So be your own patient.
That's wonderful advice. You have to get it, right?
Absolutely. Absolutely. Yeah. So other than seconding that, I think the advice I would give is don't make any assumptions about your patients. Don't assume that you have to have a balding patient walk in the door for them to be a Keravive customer. Everybody needs this. Everybody, it doesn't matter, you know, how much, even my wife, she has a lot of hair, but she was even talking to me the other day. She was like, you know, after, you know, I haven't been to the hairdresser and I don't think I've been washing it well. And I kind of see it starting to recede a little bit. You know, she wouldn't be the type of person that's going to ask, right? But every single one of your patients that are currently coming in and having HydraFacial treatments on their face are candidates for Keravive on their scalp. And so my number one thing is don't make the assumption about who is going to be a patient and who's not. Treat everybody, including yourself.
Great advice. Thank you so much, our experts and all the attendees. We know that we haven't answered quite a few of the questions, but we have your contact details and we will collect all the questions and all of them, they will be answered individually. So thank you again, everyone, and happy Keraviving. Thank you.
Thank you, everyone. Bye. Thank you.
Bye.
Thank you so much.